I knew what I was getting into because I was the deputy commissioner at Health. I worked for Mary Jo when she was the commissioner, and academically prepared in public health. You know, that's my master's degree is in public health. So, and got into public health because I had started out working in as an occupational therapist. I worked at St. Mary's, was working mostly in rehab, and made a very deliberate decision that I wanted to get upstream. That every person I worked with, whether it was a spinal cord injury or a farm accident, they were all preventable. So that's when I went to get my degree in public health. And then I think that had something to do with why Mary Jo picked me to be the deputy of the department, because I had some content and some background and understanding really the breadth and scope
Right.
of the kind of things that are done in the health department, but still regularly surprised by the things that were done in the health, you know, I guess the breadth and scope of activities in the department. So then Commissioner O'Brien, Mary Jo left, and I guess it was about February or March. My job, you know, it didn't matter if acting was in front of it or not. Statute required the Commissioner of Health to act, and I was going to do this job. So was acting for a long period of time. The governor thought, well, he didn't need to make a decision, so he wasn't going to make a decision. In about July of, I guess it was 1995, I got called into the governor's office. We were having a discussion that ranged all the way from Gopher basketball to,
Yeah.
I can't even remember. I love sport. He loves sport. We were having this long conversation. And then I went down the hallway after that conversation and meet with his chief of staff. As I'm meeting with Maury Anderson, the phone rings, and Maury picks up the phone, and it's the governor on the other end. I can hear it's the governor talking. He's like, I really like that Ann Berry. No, do you think we should just name the commission? And of course, and I'm sitting right across from Maury and feeling really uncomfortable that I'm in the middle of this conversation where he goes, well, of course. And the governor said, well, let's do it. Maury said, well, she's sitting right here. Should I send her back down to your office? And the governor said, absolutely. So I walked back down to his office.
That's our
had
name.
a conversation that, that's just, he decided it was time. It was time. And then he said, well, let's get it done. Let's name you. And I for a moment, I was going to say, well, maybe I need time to think about this, but then decided not to. So he came to the department, met with the senior leadership, and then met with staff and had an open meeting and said, I'm so comfortable and I'm so happy to name Ann as your commissioner, and that's it was odd. I had never intended. I still to this day think being a deputy is one of the greatest jobs you can have, because you can support the leaders of the organization. When you're commissioner, you really are. Those decisions are yours, and I think we all know what that feeling is like, to know that they're ours. So I'm thrilled that I had the opportunity to do the job.